All right, do you have back pain? We're going to show you the number one thing you should start to do.
Excellent, Bob. I can't wait. Say no more.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, if you have back pain, Brad, the first thing I want you to do is find out your pain relief position. It's a position where you get a relief from your pain. So everybody is different. You
Right.
have yours, I have mine, and you're going to have yours. We're going to show you 7 of them,
Okay.
and you can give them a try, and it's going to help wind down your nerves,
Right.
which can get oversensitive. So give these a try. All right, this is the first position, and it's actually the one that Brad uses. Brad, you want to talk about it?
Yeah. So you lie down on your back. You can do it on your bed or a floor, carpeted floor preferably. And to elevate your feet, this happens to be a wedge cushion made for this. It works very well. I've
Yes,
had
it does.
good success with it personally, as well as in the clinic with the majority of back pain people. You can use something other than these. You could use 2 or 3 pillows under your legs or your calves like that. It can be helpful. And I've used
If
furniture.
you're on the floor, you could use an ottoman or
Yep,
a stool.
anything that's about this height. And I've had people go up to the 90-90
Right,
position
exactly.
with success, on their furniture. And then along with this, especially if it's acute back pain, it just started that day or the day before and it's very sore. Oftentimes I'll suggest going to a cold pack. Make sure it's a good one, a gel one that does not get hard when you pull it out. The cheaper
Right.
ones do. And you'll put that so it's comfortable. You can do a homemade cold pack, which works really well. We do have a video on how to do that with
Right.
rubbing alcohol and water.
So, Brad, when do you do this?
Well, actually, I'll do this. Say I've done this a number of times if I'm out doing yard work, doing things I shouldn't be doing. I
Right.
know it, but I just got to get the work done.
It fires up the back.
Yeah, I'll go in the house, I'll lay down like this for 20 minutes, settles it down, and then I go back out to doing stuff, but not stuff I shouldn't be doing.
Again, pain relief position.
This is mine.
That's Brad's.
Yep, for sure.
All right, number 2. All right, Brad, this is a position for someone who their back hurts when they bend forward.
Ooh.
Right. So we're actually moving you in the opposite direction. But you can try it with 3 pillows
1, 2, 3,
and the ice pack,
right over
like
the
Brad.
back.
Or you could do heat,
Yep.
or you could try 2 pillows.
The goal is to get down to no pillows,
Right.
but a lot of times you cannot do that right away.
It might take days. Or you try 1 pillow.
I've gone from 3 down to no pillows in 1 hour
One
with
session,
a patient.
right.
Yep. Not always though.
We got a roll towel here for comfort for the head. You can also get down to 0 pillows.
Yeah.
Whatever works for you. Now you may even try putting your head to the left and putting your head to the right. That can make a difference in your back pain, believe it or not.
Typically, you'll lay like this, 10 to 15 minutes, probably not more than 20. And again, just keep going down. As long as that position, it feels good. It feels much better than, as opposed to sitting or
Yeah,
standing.
it's got to work for you,
Right.
or you don't do it.
Exactly.
So, Mr. Brad.
Yes.
So this is actually the position that I often use.
Yep.
And I use it for upper back pain.
Okay.
So I use the Therapeutic, which is far infrared heat, along with a reclined position.
Did you do it in an office chair or a recliner?
A recliner.
Yeah. So this, and I do the same thing.
It's a simulation.
Right. Yeah, we don't have a recliner in the studio. Maybe we'll get one someday. And so you'll be like this.
Or you can even put a throw pillow behind it, right?
Sure.
Behind the Therapeutic.
Yep. I'll do this on my low back.
Right.
On my recliner, and then I'll use this if it's not acute, and particularly in the winter time. Boy, does that make life better. Oh, there we go.
Right.
Yes.
It might be heat.
Yep,
it might be ice.
You may need to have something.
What works
there.
for you? That's what you find out.
Are you asking me?
Yeah.
No, I actually do use both. An acute, cold, otherwise tightness, heat, Thermotex.
Why do you like Thermotechs?
Well, Bob, it's far infrared. It
deep
goes
heat.
2.36 inches versus skin deep
You're
when you
right.
have a typical standard uh, heating device.
Right.
But can
So
you just let me relax, Bob?
it's a lot more comfortable. All right. This next one, Brad, is for people who have pain on the right side, the right leg or the right side of the back. And for some reason, the way this works is you put a couple pillows under your ankle, on your feet and ankle, and it twists your back a little bit,
Yep.
and it creates a little more opening in the foramen.
Yep. So then eliminates or helps reduce that sciatica. And you'll know. I mean,
Right.
you
If
agree.
it works, you use it.
Yeah.
If
And
it
you'll
doesn't, you
you'll
don't.
realize it pretty quickly when you put the pillows there.
Right. Do you want to do the other side, Brad, real quick?
You want me to
Yeah.
lie on this side?
Yeah.
Well, Bob, I'm going to smush my microphone, so I'm not going to talk.
No, that's fine. Same thing on this side. There we go. All right, Brad, what are you trying to do here?
Okay, so we're going to do a form of traction you can do at home with 2 chairs. And what the traction is going to do, here we have the red disc, which is an injured disc, perhaps herniated or bulging. And Bob's going to lift his torso and trunk up off
My
the
hands on the seat of the chair.
off of the floor, and the weight of his legs is going to pull, and you'll see I'm going to pull that, and it's going to relieve pressure on that injured disc. So it's a nice, simple way of traction. If you do it, you should feel relief right away, as well as when you're done. Bob, you want to?
Right. It might even feel good with osteoarthritis or anything.
Yep.
Get that decompression.
Exactly.
So,
Yep. I've used this many times.
Right.
I actually use a little bit different system, but the chair one works well. And you do have something under your knees just for
You
cushion.
can move it all the way too.
Yep. That's optional.
Now, that's right. We're going to show the next option. Okay, we have another option for traction, Brad.
Yeah, we're going to do some traction using our body weight again, but hanging. Now, this can be done through a pull-up bar, anything above your head that is very solid and safe to hold
branch?
on. What?
A tree
branch?
branch.
Yeah, possibly, as long as it doesn't break. We use these hanging handles. The big advantage to these is that you can go and put your back against
Right.
the wall. And whether it's the hanging handles or a pull-up bar, it's important that when you reach up and grab it, you're still
Right.
on the floor, so that when you gradually put traction through your back like I'm doing now, you can control it very safely. The wall promotes and really helps maintain good posture, as well as some resistance for control. And I'm going down, and now I've got about 50% weight, and I'm going to relax my core muscles, my stomach muscles, to allow the traction to occur. And it should feel good, and it does for me right now. As I relax, it feels like a good pull. I'm actually, look at my hips. I'm not doing this to be cute. I'm doing this because it feels good. It's
You go
loosening
back
up.
and forth. You can twist a little bit too.
Yep.
And
And
see what
only
works for you.
only do this if it feels better.
Right.
Some people may find a twist to the right. Oh, that's good. And you go to the left. Ouch. Well,
Right.
only do what feels good. Typically hanging for 30 seconds. I know my hands get tired after
Right.
30 seconds, and I feel like I had enough.
And the other advantage is you can have this in your office or bedroom
Right. Yeah, you can put it anywhere.
if your wife lets you.
As long as you've got a nice solid wall to put it on. But
Right.
yeah, I'm
Go
just
with
gonna
the studs.
hang out for a while, Bob.
All right.
Have a good
Get
day.
taller.